There is a silent thief stealing your longevity, and it's completely invisible from the outside. You can look perfectly healthy in the mirror, but inside your metabolic engine is stalling. How do you catch it before it's too late? You look beneath the surface. As we cross into our 40s and 50s, both men and women experience a profound biological shift. We feel it in our energy. Our spouses see it in our stress levels, but our doctors often miss it in our routine blood tests. Today, I'm going to show you the one scan that maps the exact blueprint of how your body is aging and how to fix it. Welcome back. If you've been following my lectures, you know we talk a lot about the biology of stress, the gut-brain connection, and how to navigate midlife with vitality. But today we are talking about measurement because you cannot manage what you do not measure. I'm Dr. Elena Chirikhina, a lifestyle medicine advocate, helping busy adults prevent disease, stay sharp, and age well through practical, evidence-based daily habits. If you're serious about your metabolic health, your longevity, and ensuring that your body can support your mind for decades to come, hit the subscribe button right now. We are building a community of people who refuse to just accept aging as a decline. Subscribe and let's dive into the data. Listen to me closely. The bathroom scale is obsolete. The body mass index, or BMI, is a flawed, outdated metric that tells us almost nothing about your actual health. You and your partner could both have a perfect BMI, yet one of you could be harboring a severe metabolic crisis. This brings us to the gold standard of body composition, the DEXA scan, dual energy X-ray absorptiometry. So, what exactly is a DEXA scan? And why needed in lifestyle medicine? Historically, DEXA scan was primarily used in hospitals simply to measure bone mineral density to check if older adults has osteoporosis. But in the modern world of longevity and proactive lifestyle medicine, a DEXA scan is our ultimate truth teller. It uses two very low doses X-ray beams, and when I say low doses, I mean it. Radiation exposure from DEXA scan is lower than the background radiation you experience on a standard cross-country flight. It is incredibly safe. These two energy beams pass through your body, and because fat, muscles, and bones all absorb the energy differently, the scanner maps your exact inner composition. It breaks your body down into three critical compartments: bone mineral density, lean tissue, which is your muscle mass, and fat mass. Why do we need this? Because as busy adults navigating the pressure of midlife, we are under constant psychological stress. We lose weight, we gain weight, we try new diets, we sit at desk for 10 hours a day. The DEXA scan removes the guesswork. It tells you exactly what you are made of, down to the gram, and exactly where that tissue is located on your body. Take a moment right now, squeeze your hands into tight fists. Feel the muscle in your forearms. As we age, starting in our 30s, but accelerating rapidly in our 40s and 50s, especially during perimenopause and menopause for women. And as testosterone drops in men, we face two silent thieves: osteopenia and Sarcopenia. Let's talk about your bones first. Bone loss is completely silent. You cannot feel your bones getting weaker. There is no pain, no fatigue, no warning sign until you step off a curb wrong or trip over a rug and suffer a life-altering fracture. A DEXA scan provides what we call a T-score, comparing your bones density to that a healthy 30 years old. It allows us to catch osteopenia early, years before it becomes severe osteoporosis. But here is the aspect of DEXA scan that I'm the most passionate about in lifestyle medicine: muscle mass. Muscle is not just for looking good at the beach. Muscle is your metabolic engine. It is an endocrine organ. It's where you dispose of glucose, keeping your blood sugar stable and preventing insulin resistance. We are seeing an epidemic of something called sarcopenic obesity. This is when a person looks thin or normal weight on the outside, but the DEXA scan reveals they have dangerously low muscle mass and a high percentage of hidden fat. They are metabolically fragile. If you don't know your baseline muscle mass, you cannot design a lifestyle protocol to protect it. Now we need to talk about fat. And not all fat is created equal. If you or your spouse are on a weight loss journey, a DEXA scan is non-negotiable. Why? Because of where your body stores fat. There is subcutaneous fat, the soft fat just beneath the skin. It might annoy you when you look in the mirror, but metabolically it's relatively harmless. Then there is a visceral fat. This is the hard fat that packs itself deep inside your abdominal cavity, wrapping around your liver, your pancreas, and your intestines. Visceral fat is highly inflammatory. It acts like a toxic factory, pumping out inflammatory cytokines into your bloodstream, driving up your risk for cardiovascular disease, type 2 diabetes, and even cognitive decline. A DEXA scan is one of the only high accurate ways to measure your visceral fat in pounds and grams. And let me warn you about weight loss. Many of my patients come to me thrilled because they have lost 15 pounds on a new diet or a new medication. But when they do a DEXA scan, we discover a tragedy. 8 of these pounds were poor, metabolically active muscle. They didn't just lose fat, they aged their metabolism by a decade. The DEXA scan prevents this. It ensures that your weight loss is actually fat loss and that your health maintenance is genuinely preventing your lean tissue. So when should you actually book a DEXA scan? Standard clinical guidance usually tell women to get their first baseline bone scan at age of 65 and men at age of 70. In lifestyle medicine, we believe that is far too late. Waiting until you are 65 to see if you have lost bone or muscle is like waiting for your car's engine to catch fire before checking the oil. If you want to prevent disease rather than just react to it, you need baseline much earlier. I recommend booking your first comprehensive body composition DEXA scan between ages of 40 and 45. Here are the key indicators that you should book one immediately, regardless of your age. First of all, you are experiencing perimenopause or menopause. The drop in estrogen rapidly accelerates bone loss and shifts that distribution toward the visceral area. Second, you are starting a major weight loss or fitness protocol. You need to know if your program is building muscle or destroying it. Third, you have a family history of osteoporosis, fractures, or early metabolic disease. Fourth, you are taking medications like corticosteroids or modern weight loss drugs like GLP-1 agonists, which carry a high risk of lean muscle depletion. This is a phenomenal thing to do as a couple. Book your scans together. Make it a shared commitment to your family longevity. It changes the conversation from I need to lose weight to we need to build our metabolic resilience. Getting the scan is only step one. Step two is translating that data into a lifestyle blueprint. And this is where the physiology of health comes in. Many people avoid getting a DEXA scan because they are afraid of what they might find. They are afraid of the numbers. This triggers what we call the crab effect. You might know this metaphor. If you put one crab in a bucket, it can easily climb out. But if you put multiple crabs in the bucket, the moment one tries to escape, others will pull it back down. When you decide to take radical ownership of your health, when you say, I'm getting to get a DEXA scan, I'm going to lift heavy weights, I'm going to optimize my sleep, your existing social circle might resist. They might pull you down, saying, why are you doing that? You look fine. Don't stress over medical scans. Just relax. You must break out of that bucket. Knowing your numbers is not stressful. Well, it is stressful, but it is empowering. Ignorance is not bliss when it comes to your health. Ignorance is just delayed pain. But you should not read these results alone. A DEXA scan provides a complex matrix of T-scores and Z-scores and regional tissue breakdowns. You need a qualified healthcare professional, a lifestyle medicine doctor or practitioner to help you read it. We don't look at the scan to give you a diagnosis and send you home. We look at the scan to design your life. If your bone density is low, we prescribe specific heavy load resistance training and adjust your vitamin D, K2 and protein intake. If your visceral fat is high, we look at your sleep architecture, your stress hormones, and your gut microbiome to calm systemic inflammation. The DEXA scan is the map. Lifestyle medicine is the vehicle that drives you to safety. Aging is unavoidable, but how you age is largely a choice. You have the power to maintain your muscle, protect your bones, and eliminate dangerous fat. But it starts with having the courage to look at the data. Find a local clinic, book a DEXA scan for body composition, and bring these results to a professional who understands lifestyle medicine. This lecture shifted your perspective today. Please subscribe to the channel. Share this video with your spouse, your partner, or a friend who needs to hear it. Let's break out of the bucket together. I'm Dr. Elena Chirikhina. Stay sharp, stay resilient, and I will see you in the next lecture.